we know she's very busy. Let's go ahead and get the Adelute Press Secretary, Krystal Paco, on the show. Morning, Krystal.
Morning, Chris.
So I guess just first of all, have we got any info on the travel history of these latest 4 positives?
Actually, all of them.
Or the last, I guess, 7,
I
right?
absolutely understand everyone wants more information on these additional cases, and I'm working aggressively to get more information. The last thing I want to do is release bad information, the way we did our first press conference. We told everybody that the traveler was on a flight on March 2nd, only to have to retract that statement after further investigation showed us that the traveler actually flew in on February 29th on that leap day. So we want to make sure that the information we're putting out is correct. I don't have any further information. I'm going to work on that. My first priority is for today. I know the people of Guam deserve to know, and I know as a former member of the media that's a priority that you guys want to put out there.
Do you guys have response activity coordinators, though? I mean, aren't they supposed to be working on getting information so that the Joint Information Center, whoever the lead person is supposed to be getting out that information to the community?
Most definitely. We do have RACS response activity coordinators, as you're talking about. That Emergency Operations Center is activated. I work with them closely. As you know, the JIC is located right next door to the Emergency Operations Center. But the information that I am putting out in my press releases on a daily basis, I'm getting that straight from the lab.
You're getting what? I'm sorry, you're breaking up. What?
I'm getting that straight from the lab. And so all this information, the RACs find out when I find out.
Okay, Krystal, we wanted to ask, when you read national reports, that come out from, bodies that are similar to the JIC and what you guys are doing, there's a lot of information in there, their age, gender, detailed travel history. Where's the blockage coming from? Because and is it just a policy for you guys to release this little information about these cases? Because we're seeing the precedent. I mean, in our neighbors in Hawaii, the media there, the releases that are coming out from HHS in Hawaii, there's just way more information. And I feel like the sticking point for us is that we want to make sure that the people listening out there, being the biggest media outlet on Guam, that we're faithful to the people who listen, that we give them the best information, or any information for that matter.
Understood. And it's not a policy blockage. It's that we really are vetting the information. Like I said, that first press conference, we told the people of Guam the wrong travel date.
Right.
And so people on the March 2nd flight were unnecessarily panicking.
Right, but I mean, if you guys put out the wrong information, I don't think that the people of Guam should have to live in a vacuum while we wait for you guys to figure things out. I mean, to be fair.
Again, Chris, this is my number one priority for the day, getting the list, putting out that information. Again, I'm not going to say the exact age, but maybe someone in their 60s, someone in their 30s, male, female, travel history, where to. And so as we've already previously noted, the confirmed cases, the ones with travel history did travel to the Philippines. And that is why we have the stronger mandatory quarantine protocols for individuals arriving from the Philippines.
Right. Where are we on the test kits? We haven't been able to get a straight answer out of you guys. We spoke to a couple senators. They said the governor had told them less than 200. Obviously, we've tested a lot of people. So if you could provide us, is there an accurate number as of at this moment?
Can we start, though? How many test kits arrived? How many test kits did we have?
So I understand is that, when the boxes of test kits arrive, it's not a set number because it's an approximate number. It's approximately you can test as many people. I have to speak to our epidemiologists and our lab guys about what that exact number is. But I was assured that we have enough test kits at this point. We've made ask from the CDC, and we are going to receive more test kits shortly, very, very soon.
What's the approximate number that you guys received?
I can't say at this time, but I can also tell you that our public health director, Linda Pinco-Denorsi, she just signed, I believe it was yesterday, a contract with DLS so that we can send more of our test samples off island. We can send them to Hawaii. We can send them to California. So we are exploring all our options. We've also had some of the doctors here present to us options for purchasing additional test kits. As you know, the CDC has broadened their criteria. Not broadened their criteria, but they've allowed us to use WHO certified test kits, not just CDC or FDA approved. So, as you know, people in the region are able to do their own tests, and how come we're not able to do that? So now they're allowing us to do that, and so we're exploring our options. Maybe we need to buy another machine. Maybe we need to buy more test kits from another place. So we're actively seeking that out, but I can tell you that as of yesterday, Linda Norcy. She signed a contract with DLS, so we can send more of our samples off island.
But you're still not telling us how many test kits we have. We're hearing that it's under 200, and is that affecting the response here? Because if you look at other jurisdictions, and I know we're not other jurisdictions, but how they're kind of turning the corner on COVID-19 is by testing a lot of people, and we just simply don't have that capability right now, right?
Well, we're building our capacity every day, not just with test kits, but our doctors and our healthcare providers. Earlier this week we added almost 50 nurses we activated almost 50 nurses, and they're helping with our community health centers. They're helping at the airport. They're helping at the hospital.
School nurses, right? School nurses?
School nurses,
yeah.
yes, school nurses. And so we've also added, as you heard last night, we've added Dr. Mike Cruz as our state surgeon, Dr. Jolene Uggan. She is a pulmonologist. Her specialty is respiratory diseases, or respiratory disorders. And so we're building our capacity every day. This is an unprecedented event.
Okay, you said enough test kits. What is enough? How do you determine what is enough?
I can tell you we'll make it through the next few days comfortably.
Why can't you give us a number, though, like a ballpark? Do we have 150? I don't understand. We asked Carlo. We got, run around the island from Carlo. We're not getting anything from you. I just think people are maybe, you don't want to release a number because you feel like it's going to cause anxiety maybe, or we don't understand why that information is.
Because I honestly don't know the number, but I have been assured that we have enough to get through the day until we get our additional test kits, and I can tell you that's coming very soon.
So we're comfortable for the next several days with the test kits that we currently have.
I feel comfortable saying that, yes.
You feel comfortable saying it, but...
Also, I've been assured from public health.
Okay.
What's going on today? What's the plan for today? Have we already received any samples from any of the clinics, or what are we doing as far as testing? You have anything on that?
I don't have any updates. I didn't get my brief yet. You know that my brief is usually at 7:30 in the morning. It got pushed back a little bit for today. Every day it's a new day, and we have to take guidance. We wake up and it's new news.
What about the status of the skilled nursing unit?
It opened late yesterday afternoon. I understand that we received our first COVID isolation patient there. And this person was transported straight from GMH to the skilled nursing facility.
So everybody that's at GMH, the isolation unit there, they're all going to be transferred up to SNU?
I believe we have separate staff, and we have separate staff for COVID ISO. That's COVID isolation. That's what we're calling the SNU at this point.
Krystal, so the SNU, has the entire SNU been fully converted to be able to handle these COVID-19 patients, or did we do a partial opening?
At this point, I believe it's just a partial opening. I believe 2 of the 3 wings are ready for patients.
How many people?
For my last briefing.
Okay, so how many people are at the ISO unit at GMH?
I haven't got briefed on that this morning. If I can get back to you.
Okay, how many were there yesterday?
I stepped out of the meeting at that point so I could write your press release on the confirmed cases.
Yeah, that's the problem, is that if you step out of a meeting and then we don't get information, I just feel like there's a gap.
But you also want the confirmed cases, so...
Well, we want it all, Krystal. We don't want to have to pick and choose what we want based on how available you are to attend a meeting. I mean, it's pretty simple.
Understood. And I want to make sure that I'm putting out accurate information. As you know, misinformation can spread just as fast as the virus itself.
Right.
All right, so how many are you aware of from the last briefing that you can recall were at the ISO unit?
At the last briefing, I could say that...
Did you remember?
At least 3, and those were the 3 confirmed cases from earlier.
Okay, and so...
In the GMH ISO.
So out of the 8, or we're at 12 confirmed cases, how many are at GMH?
I have to follow up on that.
Krystal, while we're on GMH, so there was a voice note going around, and you guys had previously discounted other similar types of unverified messages that were going around. This was a video about, I'm sure you saw it, this whole
I sent it to her yesterday.
GMH is infected or whatever. Why wasn't there...
Was that the one with the Snapchat filter?
Yeah.
That one, and then the audio, the 2 audio files.
So were they the same audio?
Yes.
Yeah.
Okay. So we're working to address that. I called Lillian yesterday. Lillian Patadas, our GMH administrator, and I got on the phone with her trying to understand what the situation is.
So
I'm
is
still
there
working
is
to
there
get
a
clarity.
situation at GMH and where any of the staff there were exposed to the coronavirus, where any protocol was broken?
I'm not tracking that. So I'll work to get more clarity this morning, along with more information on our passengers or confirmed cases at this point.
So you haven't heard at all if there were any health care professionals at the Guam Memorial Hospital caring for COVID-19 patients that were exposed to the virus or quarantined or anything?
Or tested positive?
Nothing I'm tracking.
What about if you could verify or provide any more insight? Is that we had tips that there was an employee of civil defense that may have been exposed to somebody who also tested positive, and we're hearing this from staff at civil defense. So we're not sure about that. If there's any verification we get on that.
That's worrisome because, as you know, I spent all of my day, my 16-plus hour workday at civil defense, but I don't know of anybody that's been tested in my surroundings.
So that's not verified.
That's not verified.
Okay, so
What about the status of the COVID-19 patients? Are you able to give us anything on how they're doing, generally speaking?
Generally speaking, I can't tell you the last four, but last night's four, I haven't got any updates on them, but I can tell you they all remain in isolation, and that's all I know at this point. I'm so sorry, Chris, and I'm so sorry, Bree. And as you know, I know what it's like to be on the other side, wanting more information, and I'm feeding as much information as I can get out of that properly.
It's just simply not. I mean,
are you the only one working on getting this information out? Do you have a communications director that also works with you? Or
Yes, I have a communications director. We have an activated JIC. That's the Joint Information Center. It's Homeland Security. We have Public Health. We have DOE. We have the airport, Customs, GPD.
that's
fire.
what I'm saying. If you have all these people, then why are the information is not matching the number of people? And Krystal, again, it's just very frustrating for us because all we're trying to do, we're not trying to hassle you, not trying to pull you out of meetings.
yeah, these
We're just
aren't
trying to make
difficult
sure that people
questions.
know that what's going on, that they have the information, and really it's just I can't wrap my mind around it. I understand it's a new administration. There's probably some growing pains, but really our intent is not to fluster you or anything. It's just really the main motive is to get the information out to the people, and it's just simply not happening. And I'm just not. I don't hear good enough justification. I think we need to do better.
And I'm glad for the feedback, and I'm working every day, and our team is working every day to get better. As I said before, this is an ever-evolving situation. It's unprecedented, and every morning we have to change our game plan because the other day we woke up and we knew we were going to get an influx of passengers coming from the Philippines. So we had to change. We had to we had to adapt to the changing situation. Yesterday, as you know, the governor signed Executive Order 2020-05 for Social Isolation Directive, and this is just another step in our protective measures to protect the people of Guam.
Why haven't we seen the governor, other than a special address, just as kind of by comparison? I'm not saying she's President Trump, but, President Trump, governors of other jurisdictions are presenting themselves to the public in an atmosphere where the media can ask questions and have those questions answered. We haven't had that opportunity since Sunday. I know it's a crazy week, but we're just kind of wondering, but more so than us, the people are wondering.
Of course. And I can tell you I had a press conference scheduled yesterday and that we had to change that plan because we decided we had to adapt. And that's why you saw the social isolation directive guidance.
Yeah,
So
we got that from the
I
legislature. We didn't get that from Adelup until 3-4 hours later.
I was sharing it.
With
again,
who?
I was trying
It
to
wasn't
work
the
on
media.
FAQs. I was working on the FAQs because we were bombarded with questions, Bree. And I wanted to make sure there was clarity before we sent it out. Unfortunately, the legislature may have sent it out faster than we could, but we wanted to make sure that there was clarity.
Well, I think the legislature sent it out because they got it, and it was some major information that people needed to know. I think that's why they sent it out.
And it prompted a lot more questions.
Sure.
And so that is why we issued the guidance shortly after. And so, unfortunately, they were able to push out the executive order signing before I was able to answer all the questions and give that guidance. So we were bombarded at the Joint Information Center with all the questions. Can I have a funeral? Can I have a drive-through? Do the hotels have to close? Does my fitness center have to close? Does my bakery have to close? And so we are working actively. You saw the guidance, about 2 pages,
Yeah, so the FAQs, you didn't have the FAQs ready before sending out the executive order, not anticipating that you would have this flurry of questions.
Most definitely. And that could have been improved. We could have definitely improved our processes in that point.
It kind of seems like you need some help.
Yeah.
I mean, if you can't sit in meetings and you can't, I mean, who's managing the JIC? Traditionally the communications director, right?
We have Carlo Branch also with us, and we're a very stable team. Thank you.
Anything else, Bree?
I'm kind of just... yeah, I do have something else. You know, there's this video that is circulating, or actually it's not even circulating. It's up on the World Wide Web. There was a promotion, I understand. It was of the governor and lieutenant governor. Excuse me?
Again, it's being pulled down.
Mm-hmm.
I spoke with GVB this morning. It was an oversight on our part. We didn't pull it down. Again, we expected to pull it down once we had confirmed cases, and that didn't happen. A lot of moving parts, Bree and Chris, and I know you understand it's crazy, and we're adapting every day.
Well, the people don't want to hear that it's crazy from the people who are in charge. So, I mean,
well, it's crazy in the sense that we're having like every morning we get new guidance. CDC, broadens their guidance, or Trump will say, okay, 50, now 10. And so
let's ask you about that.
I wanted to go back, to this video. When was this video posted?
This video was posted over a month ago, I want to say.
In
and
February.
That was specific to the markets.
Right,
so whose idea was it then that let's promote the fact that Guam is coronavirus free in the middle of a crisis?
That was prior to any of our confirmed cases, Bree.
Yeah, but
yeah,
I mean,
but
there were
doesn't matter.
Coronavirus was confirmed in other jurisdictions that we were marketing to, I think is the point.
And where was this? This was, what language was this? Korean? Japanese?
I saw only the screenshot of it. That might have been an Asian market. I'm not sure which one.
Is this the only video to this particular Asian market, or was it sent to Japan? I mean...
It's being pulled off all our markets.
Okay. Let's going back to what you said about President Trump's directive. I'm pretty sure it's almost a moot point now that the social isolation order has come down. But are we doing any downward adjustment to 10 people or anything like that?
No. Again, just keep it under 50. Our threshold remains 50. But again, the social isolation directive will cover that. Basically, closing any places with congregations or any areas with congregations.
Right. Yeah.
Just you know what I mean. Closing down any congregating areas. I think I saw pictures of McDonald's, and they had signs, and they're basically saying our dining room is closed, but you can do takeout. You can do the drive-through.
Can you give us any more info on the Trace investigation, going back to Sunday when you guys erroneously announced the flight information and later corrected it? How has Public Health's Trace investigation? We're able to kind of just put some things together in talking to a couple of mayors this morning, but we know that you have access, so we kind of want to know where we are on that.
Again, several individuals have been identified as potential close contacts, and so they are being interviewed, and if a test is warranted, that will happen.
The mayors, they are asking some sort of more transparency from the Joint Information Center from Adelup in terms of whether their villages, whether there are any residents that have tested positive from their villages. Why can't they get that information?
I wasn't even aware that. I thought I was tracking that they were updated. We can do a better job at updating our mayors.
Yeah, none of them were updated, actually.
Okay, noted.
Okay. So again, are we going to be able to get that information? Because they said basically Mayor Hoffman, Mayor Gogui, and Mayor Louise, also Mayor Melissa, had said that during the dengue outbreak, you guys didn't have a problem telling them what villages were affected. So I guess, in their mind, they're kind of wondering, well, why doesn't the same logic apply to COVID-19, which is obviously a pandemic level threat?
And then that was why one of our first steps was closing our senior centers, because they're the most vulnerable population. So let's protect them first, and then shortly after, the school closures happen. So
yeah, but why haven't we told the mayors if they have COVID-19 positive patients in the villages?
Well, we can definitely work on our communication then. Thanks, Chris.
Brianna?
So you guys plan to let them know?
I was. I mean, I would have hoped. I believe that they were contacted, but I guess not. And thank you for bringing that to my attention. You know, we can
Are
definitely.
you going to include those in the press releases too?
And that's the first thing I will get to after I get off the phone with you is gathering more information about all the confirmed cases.
I feel like we need to let you get off the phone so you can go gather information.
Yes, sir.
Okay, so anything else you want to ask, Bree?
I probably won't get an answer, but is there anything you'd like to say? Krystal.
I'm thinking there's so much I want to say. Again, the situation continues to evolve. I want just people to stay home at this point. That's what the governor really wants. People to stay home. Let's stop the spread of COVID-19. Stay home. Limit your exposure. If you have to go out, go to the grocery store and come back home. What I've been hearing about is businesses limiting the amount of people that come in, and even the people that are waiting outside in line, they're practicing social distancing. We can't emphasize that enough. And if you're sick, stay home. If you're going to cough or sneeze, even if you're not sick, we sometimes they cough or sneeze. Cough and sneeze into your arm. Don't touch your face. Wash your hands regularly. I know it's basic. I know it's not sexy, but wash your hands regularly.
It's actually pretty sexy to wash your hands. Yeah. Hey, Krystal, sorry to interrupt, but just real quick, are we concerned about the governor's health? She is at that age where she is one of the vulnerable members. Is that maybe why we haven't seen? Is she doing self-quarantine? Is there anything you could tell us about that?
She's not doing self-quarantine, and we just want to make sure that she gets enough rest as well. I think all of us are a little sleep-deprived, working like 20-hour work days. So as long as she keeps her rest, I'm sure our Magahaga will be fine.
Have you gotten any feedback on how the mandatory quarantine protocols and processes have been going? Because we've been getting phone calls. We've probably even seen the pictures on social media that they're calling it unorganized, and people there are concerned. I mean, about they come in and some of them have done self-isolation, and then they're mixed in with all these people at the terminal, shuttled onto buses, and then go to the quarantine-approved facilities, and people aren't wearing protective equipment, and they're really concerned that they may not have had the COVID virus
you didn't have
coming
COVID-19
in,
before.
but now there's a strong possibility that they might.
And as you can imagine, the first day of a rollout, there will be hiccups. I can assure you that many of those hiccups have been addressed today.
All right.
You
Well,
can assure that they've been addressed today. Okay.
The ones that I'm aware of, yes.
Okay, Krystal.
Thanks, Chris.
Okay, we'll see you.
Thank
There
you.
you go. Guadalupe, Press Secretary Krystal Paco, 7:54. We're going to get Major Joe Blas on